I told you that we are going to discuss about the drugs which are used to control nausea and vomiting. I told you that mostly books are discussing about the nausea and vomiting which is related with the use of chemotherapeutic agent, which is of more concern than any other condition. I was starting with the introduction that nausea and vomiting may result from wide variety of conditions, including adverse effects from medications, systemic disorders or infections, pregnancy, vestibular dysfunction, CNS infection, or increased pressure, radiation, chemotherapy, gastrointestinal obstruction, and dysmortality. All these are the problems that can cause nausea or vomiting. Now come to the chemotherapeutic induced vomiting and nausea and the factors which are aggravating such conditions. 80% of patients who undergo chemotherapy experience nausea and vomiting. So, the factors which are responsible or which can increase the severity, including specific chemotherapeutic agents, dose, route of administration, and schedule of administration, patient variable, and all these problems can affect the quality of life. I shown in the picture a layout that is describing location of chemoreceptor trigger zone as well as vomiting center and the afferent pathways which are stimulating both these areas which are basically involved in the emesis or induction of vomiting. These are comprising of central nervous system, gastrointestinal system, and vestibular system. How the afferent nerve will pass or give signal which are either transmitted from any of the organs, either GIT, either nervous system, or vestibular apparatus, and that will initiate vomiting center and CDC. And ultimately, vomiting center will transmit the impulses in terms of efferent neuron to the GIT organ for the expulsion of GIT contents in terms of vomiting. Now, there are different receptors located in the chemoreceptor trigger zone as well as in the vomiting center, which are controlling the entire mechanism of emesis. In the chemoreceptor trigger zone, which is located in area posterior, there are three different types of receptors. One is the chemoreceptor. Second one, which is related with the neurotransmitter, is T2 receptor. NK1 receptor, that is neurokinin-1 receptors, and 5-HT3 receptors. While in vomiting center, we have four different types of receptor: H1 receptor, N1 receptor, NK1 receptor, and 5-HT3 receptors. While in central nervous system, cortex, thalamus, hypothalamus, and meninges, these are carrying impulses and they transmit it to the medulla oblongata where the emetic centers are present. While in the GI tract is stimulated by the mechanical receptors as well as chemoreceptor and 5-HT3 receptors for the transmission of impulses in terms of efferent circuit towards the vomiting center. And similarly, vestibular apparatus, which is basically controlling equilibrium of the body, that is having two different types of receptors, H1 and M1, which transmit impulses again into the fourth ventricle where emetic center is located. Is that clear to all of you? Okay, so Apron inputs are controlling, and two regions, including vomiting center and CTC, are responsible for the genesis and production of vomiting. Now come to the emetic potential and distribution of chemotherapeutic agent on the basis of their potential to induce emesis. This is in fact a new thing which I haven't taught you in the previous class. Okay? So there is a different class of chemotherapeutic agent. Some of these are highly emetic, and these are of more concern for the physician to control the emesis, while some are low and some are moderate. Those medications which are highly effective to induce vomiting, including cisplatin, dacarbazine, and streptozotocin. These three drugs are very strongly categorized in emetic category, in emetic or emesis induced category. Means they have more potential to induce emesis, and these are of more concern for the physician. अच्छा, ये जो मैं आपको बता रही हूँ कि आप लोग ड्रग के नाम मैं नहीं भी आपने लिखे तो कोई मसला नहीं है, आप उसको नोट करेंगे. लिविंग कॉर्ड से मैंने इसका पूरा स्ट्रक्चर उठाया है, पूरा जो लेआउट का जो पिक्चर है, फिगर है, मैंने वहीं से उठाई है. तो आप उसको नई बुक ले लें या प्रीवियस बुक में भी होना चाहिए, इमीडिएटली जो अभी आई होगी उसमें देख लें, आपको ये मिल जाएगा. स्ट्रॉन्ग एमिसिस कौन इंड्यूस कर रहा है, माइल्ड कौन है, मॉडरेट कौन सी ड्रग है. तो जो बहुत कंसर्न होता है सिस्प्लाटिन बहुत ज्यादा एमिसिस इंड्यूस करती है, तो उसी ट्रीटमेंट के लिए हमें एंटी एमेटिक्स देने पड़ते हैं. अच्छा जी, एमेटिक एक्शन ऑफ कीमोथेरेपेटिक एजेंट कैन बी occurring due to the direct stimulation of CTZ and vomiting center. Several neuroreceptors, including dopamine receptor, type 2, serotonin type 3, play a critical role in induction of emesis. Chemotherapeutic drugs can also act peripherally by causing cell damage or GI tract damage, and that will release serotonin neurotransmitter from the enterochromatin cell of the small intestine. Now, serotonin activates 5-HT3 receptors on vagal afferent fiber. What is happening? It is basically the mechanism of induction of vomiting by the chemotherapeutic agent, that they are stimulating or damaging cell wall of the GI tract, which ultimately containing 5-HT3 receptors, which are, when combined with the serotonin, they transmit the afferent impulses towards, it is basically carrying sensory impulses, and it will transmit it to the medulla, and then it will lead to cause emesis. This is the normal phenomena of emesis induced by chemotherapeutic agents. Now there are different books classifying anti-emetic into 8 classes or 7 classes, and some are also explaining that the combination of medication is another category in anti-emetic agent. Is there any problem? Your faces are so blank. Sorry, I'm going fast. Okay. तो अभी तो आप कह रहे थे कि पुराना पढ़ाया हुआ, ये नया पढ़ाया. अब तक की जो चीज मैंने बताई, आपको ये बताया कि कौन से एमेटिक इंड्यूसिंग एजेंट्स हैं कीमोथेरेपेटिक ड्रग्स में से, कौन से ज्यादा स्ट्रॉन्ग है, और वही ज्यादा कंसर्न होता है डॉक्टर्स का कि उनको वो ट्रीट करें, उसकी वजह से जो एमेसिस इंड्यूस हो रही है. फिर मैंने आपको बताया मैकेनिज्म जिसकी वजह से और कौन से वो न्यूरॉन्स हैं, कौन से वो एफरेंट फाइबर हैं जो एक्टिवेट हो जाते हैं और सिग्नल ट्रांसमिट करते हैं व्हेन अ पर्सन इज यूजिंग कीमोथेरेप्यूटिक ड्रग्स। तो वो किस तरह से, किस फिनोमेना से और किस मैकेनिज्म से इल्नेस इंड्यूस करते हैं। नाउ वी आर डिस्कसिंग अबाउट द क्लासिफिकेशन। ऑलमोस्ट द drugs which are including in as using as an anti-emetic are classified into 8 to 7 different classes. The first one is anticholinergic. Slow हो जाती हूँ, ठीक है? Anticholinergic. Second class is H1 receptor or antihistamine drugs. Third class, including prokinetics. Fourth is 5-HT3 antagonist. Then NK1 receptor blocker or antagonist. Next class is of neuroleptics. Neuroleptics. There are certain other groups which are not containing any specific drug, or these are not containing the drug which can induce or which can control emesis by a specific mechanism. So some books are categorizing them as the others category. Okay? So in other categories, we are having benzodiazepine, which is an anxiolytic. We are having corticosteroids and synthetic cannabis or cannabinoids. In the beginning, during the introduction, that there are different other reasons and there are different other problems or pathological conditions which can induce emesis, and I say that one of them is the motion sickness. So the drugs which are used to control emesis associated with motion sickness are basically the antihistamine or H1 receptor antagonist. Why? Because if you check the previous note which you have already noted down, that there are vestibular traders which are having M1 and H1 receptor. Okay? So those emesis which are resulting due to the motion sickness, or emesis which is associated with the motion sickness or trembling, that can be controlled by giving anti-emetic H1 receptor antagonists. And you might heard the name of diphenhydramine, diphenhydrinate, Benadryl. All these drugs are used as an anti-emetic for the control of motion sickness induced emesis. Is it clear? Benadryl का नाम सुना? Phenargin का नाम सुना? ये सारे इसी कैटेगरी के हैं. Gravinol and Gravol ये भी सुना होगा, ठीक है? अच्छा, so in my slide, when once these will be received by you, and when you will check that I have explained them as a different kind of emesis and the drugs which are used to control different kind of emesis. Now come to the second type of emesis which is occurring during pregnancy. During pregnancy, usually in pregnancy, those drugs are given which are safest. ठीक है, प्रेगनेंसी में जब भी कोई ड्रग दी जाएगी वो सेफेस्ट होनी चाहिए. तो विटामिन B6 is usually recommended, as well as dimenhydrinate. Dimenhydrinate, which comes either in the tablet form with the name of Dramamine and Gregol. Gregol and Dramamine and vitamin B6. Third kind of emesis that is induced after surgery. That is induced after surgery. That is induced after surgery. It is not necessary that all the people who are undergoing into surgical procedure can encounter with the emesis. It is not necessary. It varies and it varies patient to patient, as well as the threshold. Depends upon the threshold of CTZ. If the threshold is low, then definitely once the patient wakes, it immediately suffer due to the high emesis. So those antiemetics which are used after surgery, these are comprising of serotonin receptor blocker, dopamine receptor blocker, and corticosteroids. Usually corticosteroids are not given as a single medication, but these are given along with the other class of antiemetic agents. Usually corticosteroid, for example, अगर आप आई के प्रिपरेशन देखें, आई इन्फेक्शन होता है तो corticosteroid लिमिटेडली जो है वो एज ए सिंगल मेडिकेशन दी जाती है, उसको कंबाइन करके कोब्राडेक्स आ गई आपके पास आई इन्फेक्शन में, तो उसमें क्या है, टोब्रामाइसिन भी है और डेक्सामेथासोन भी है। तो ये जो दो कॉम्बिनेशन होते हैं, इसका रीजन कॉम्बिनेशन इसलिए बनाई जाती है मेडिकेशन की कि एक तो जो साइड इफेक्ट किसी एक ड्रग के हैं उसको मिनिमाइज कर दिया जाए, प्लस अगर डोज रिलेटेड इफेक्ट है तो उनको भी मिनिमाइज कर दिया जाए और दोनों का सिनर्जिस्टिक इफेक्ट हमें मिल जाए। ठीक है, मींस हाई इफेक्ट्स, highly efficacious compound can be synthesized by giving combination. That's why combinations are good as compared to single drugs, or in those cases where the drugs are having drastic type of adverse reactions. For example, extrapyramidal effects are associated with the neurotransmitter blocking agents. So to minimize their effect, if the drug is used for the prolonged period of time, we can give combinations, or in combination corticosteroids are preferred. So those antiemetics which are given after surgery, I said these are the different classes: serotonin blocker, dopamine receptor blocker, and corticosteroids. And these are including dexamethasone, droperidone, granisterone, metoclopramide, and ondansetron. Now the next kind of emesis which is associated with the use of chemotherapeutic agent, in that case we usually give serotonin and dopamine receptor blocker, as well as NK1 receptor blockers with and without corticosteroids. If we talk about the ADR, adverse drug reactions, which are associated with the use of different class of antiemetic. The first one is antihistamine. Most common adverse effect which is associated with the use of antihistamine is antihistamines पढ़े होंगे ना आपने? Yes, और क्या हो सकता है? कोई ऐसा antihistamine के adverse effect most common. Dryness of mouth, and dry nasal passage. Dry nasal passage. Cannabinoids. Cannabinoids. Cannabinoids क्या होते हैं? कॉग्नोसी में पढ़ा होगा आपने. Cannabinoids. Cannabis sativa. ये नहीं पढ़ा. ये these are the medications which can alter the state of perception. Alter the state of perception and induce hallucination and dizziness. Hallucination and dizziness. अच्छा ये लीगली अप्रूव नहीं है, लेकिन वो केसेस जो किसी भी मेडिकेशन से ट्रीट नहीं हो रहे होते, तो फिर अल्टीमेटली फॉर एग्जाम्पल मॉर्फिन है. जब आपने देखा होगा कि लास्ट स्टेज होती है कैंसर के पेशेंट की, तो फिर पेन किसी चीज से कंट्रोल नहीं होगा, तो फिर उसे मॉर्फिन पे ले जाते हैं ताकि वो ज्यादा टाइम होता है और उसको पेन फील ना हो. पेन जो ट्रिगर होता है उसमें वो कंट्रोल नहीं होता बिल्कुल लास्ट स्टेज में, तो फिर उन क्वालिटी को डिपेंड करता है कैंसर की टाइप पर, तो फिर उनको मॉर्फिन लास्ट स्टेज में दिया जाता है ताकि वो प्रोलॉन्ग सोते रहें, उनका सीएनएस डिप्रेस रहे, तो सारा सिस्टम ऑटोमेटिकली डिप्रेस रहेगा. So, corticosteroids, the most common adverse effect which is associated with the use of corticosteroid is indigestion and induction of acne, acne vulgaris. Acne, yes, as well as increased appetite and thirst. इसीलिए जो corticosteroids यूज करते हैं फिर उसके बाद लंबे अरसे तक यूज करते करते वेट पुनः होना शुरू हो जाता है. ये बहुत ही ड्रास्टिक इसका एडवर्स इफेक्ट है कि आपकी एपेटाइट को भी बढ़ा देता है, वो आपके थर्स्ट को भी बढ़ा देता है. सही. डोपामिन रिसेप्टर ब्लॉकर, they induce usually fatigue, constipation and ringing in the ears. Fatigue, constipation and ringing in the ear. While NK1 receptor or neurokinin 1 receptor, which are associated with the substance P, they can induce heartburn, they can induce dry mouth, as well as reduce urine volume. While serotonin receptor blockers will produce a similar type of adverse effect which are associated with the dopamine receptor blocker. For example, constipation, fatigue, as well as dryness of mouth. If you will check the Lippincott book, they have given anti-emetic activity on the basis of strong, mild and low. They have categorized the different class of compounds according to their strong activity to control emesis, mild activity and low activity. So if we talk about the anti-emetic activity of only strong medications which are strongly reducing emesis, they are comprising of phenothiazine, serotonin antagonist, and substituted benzamide. These three class of drugs are including in those medications which are having a strong anti-emetic property. While antihistamine, anticholinergic, and benzodiazepines, these are having low tendency to control emesis. Now, if we discuss about the class of medication and their possible mechanism of action, I have drawn a complete table which is explaining, or it is a precise form of, ये कहते हैं कि मैं दरिया को पूरी और बंद करने के बाद कि मैंने तमाम की लिस्ट बनाई है एक स्लाइड में. लिस्ट में क्लासिफिकेशन ऑफ मेडिकेशन जो जो डिफरेंट क्लासेस ली जाती हैं जो मैंने अभी शुरू में डिस्कस की, उसके साथ उनका मैकेनिज्म क्या है, वो किस जगह पे एक्ट कर रही है और कैसे एक्ट कर रही है. अब अगर आप रिकॉल करें तो मैंने आपको शुरू में बताया था कि एक तो रिसेप्टर एफरेंट ऑर्गन्स पर है, वेस्टिबुलर है, जीआईटी है, सेंट्रल नर्वस सिस्टम है. सेंट्रल नर्वस सिस्टम से एनालिसिस कैसे प्रोड्यूस होगी. फॉर एग्जांपल आपको लास्ट टाइम भी बताया था कि एग्जाम की तैयारी करें, एंजाइटी हो गई, डिप्रेशन में चले गए, तो अल्टीमेटली बात को एक्सपीरियंस करते हैं तो वॉमिटिंग शुरू हो जाती है. जितना खाना कम खाना शुरू कर देते हैं और उस एंजाइटी को बर्दाश्त नहीं कर सकते, तो वो जाके जो आपका सीटीसी है उसको स्टिमुलेट कर देता है. वहाँ का जो सिग्नल ट्रांसमीटर है, वहाँ का ट्रांसमीटर जो सीएनएस में वो ट्रांसमिट कर रहा है इम्पल्सेस आपके मेडुला ऑब्लोंगेटा में, जहाँ पर के आपका वॉमिटिंग सेंटर लोकेटेड है. फिर वो वॉमिटिंग सेंटर जब एक्टिवेट होगा तो वो इफरेंट नाम जो कि कॉलिनर्जिक होंगी और वो जाके आपके जीआईटी में जाएंगी और जीआईटी को जो कंटेंट है उसको एक्सपेल आउट करने का सिग्नल देंगे, उसको एक्टिवेट करने और स्पेनिटर को क्लोज करने. स्पेनिटर क्या करता है, मूवमेंट करता है आपके खून की नीचे की डायरेक्शन में. वंस द स्पेनिटर इज constricted, then ultimately whenever the contents present in the stomach, they will expel out. So in the first class, I have explained that phenothiazine, and the example of phenothiazine is prochlorperazine. Prochlorperazine. If you are unable to write, don't write. I will give the complete slide after complete discussion. Okay. Otherwise, you can see lipid cord as well as cat's meat. Phenothiazine, which is including prochlorperazine. This class acts by blocking dopamine receptor, which are located in the CTZ. This class acts by blocking dopamine receptors, which are located in CTZ. What is CTZ? Chemoreceptor trigger zone. Now come to the second class, 5-HT receptor blocker. 5-HT receptor blocker. Most commonly used medication in this class including granistrone, ondansetron, and dolasetron. They selectively and competitively bind with 5-HT3 receptor in the periphery. That is the visceral vagal afferent transmission. ठीक है, पहले वाले में मैं आपको बताया कि जो phenothiazine है उससे CTZ के डोपामीन रिसेप्टर को ब्लॉक कर रहे हैं कि एफरेंट नाउ चलेगा और उसको स्टिमुलेट करेगा, बट वो स्टिमुलेट नहीं कर पाएगा तो डोपामीन रिसेप्टर ब्लॉक है. जो दूसरी क्लास है वो सिर्फ सीटीसी या जो सेंटर है उसको ब्लॉक नहीं कर रहा, बल्कि पेरिफेरल जो एरिया है आपका जहाँ से कि एफरेंट न्यूरॉन ट्रांसमिट कर रहे हैं इम्पल्सेस को, उसको भी ब्लॉक करेगा. हाउ? By selectively blocking 5-HT3 receptor in the periphery as well as in the CTZ. And these are the most strongest drug in anti-emetic classes which are used for the treatment of CINV. CINV stands for? Because of their superior efficacy and longer duration of action. If someone asks you that why 5-HT3 receptor blockers are important to control chemoreceptor-induced illnesses, you can give the answer that they are having prolonged action as well as the duration is very prolonged. And if we check about being pharmacists, if we know about patient compliance is always based on the medication which are given for the 1 or 2 times a day rather to give multiple times. And in that condition, definitely patient compliance is better controlled by giving 5-HT3 receptor antagonists. Now the third class are substituted benzamide. Substituted benzamide. And the common drug in this class is metoclopramide. Metoclopramide, which inhibit or block dopamine receptor in CTZ, and one of the major adverse effects associated with the use of substituted benzamide is extrapyramidal effect. Extrapyramidal effect कभी पढ़ा? Extrapyramidal effect जिसमें के हाथ पैर टेढ़े हो जाते हैं, मुड़ जाते हैं, कहते हैं एक्सट्रीम एरिया के इफेक्ट्स है और वो नर्व पे जाके डोपामिन सबको ब्लॉक कर रही होती है. ये आप ये देखें इनहिबिट कर रही है सीटीसी में भी, बट मैंने सिलेक्टिव नहीं कहा है इसमें. ये सिलेक्टिव नहीं है, इसी वजह से एक्स्ट्रा पैरामीटर इसके इफेक्ट आते हैं. तो इसका ये ड्रॉबैक है सब्स्टिट्यूटेड बेंजामाइड का. ऑल्दो इट इज इन यूज metoclopramide, but it is inducing extra parameter effect. Now in the next slides I will let you know that to minimize these adverse effects, we are giving combination of it along with the corticosteroid. The next class is butyrophenol, which are including haloperidol and droperidol. Haloperidol and droperidol, they again act by dopamine blocker and antagonist. They act by blocking dopamine receptor, or we can say that these are dopamine antagonists. Usually these are given for sedation during endoscopy. Usually these are given for sedation during endoscopy and surgery. But the drawback or the adverse effect which is commonly associated with butyrophenol is the prolongation of QT interval. QT interval, if you check the ECGP, there is a QT interval having a minimum size, but this size of QT interval will become prolonged and it ultimately transmits cardiac problem. So these class of compounds are only reserved for those patients who are not responding to any other medication. ठीक है? QT को prolong करता है, तो इस वजह से ये रिजर्व है उन पेशेंट्स के लिए जो किसी और एंटी एमेटिक से रिस्पॉन्ड नहीं कर सकते. कौन सी वाली? ब्यूटारोफेनॉल. ब्यूटारोफेनॉल में कौन? ड्रोपेरिडोल एंड हेलोपेरिडोल, दो तरह के कंपाउंड्स हैं इंक्लूडेड. Now come to benzodiazepines, which are basically the class of sedative and anxiolytic drugs. These are sedative and anxiolytic drugs, as well as having amnestic property or inducing amnesia. And most commonly used medication in this class are lorazepam and alprazolam. Lorazepam and alprazolam because these are minimizing anxiety. These are minimizing anxiety and inducing sedation. Therefore, benzodiazepine are useful in the treatment of anticipatory emesis. Anticipatory emesis means यहाँ हमें पता नहीं है कि वॉमिटिंग होगी, मुतवक्को है, एक्सपेक्टेड है. लास्ट टाइम आप लोगों ने बताया था कि इसका मतलब है एक्सपेक्टेड है, जरूरी नहीं है हो. तो बेंजालीन का अमूमन सर्जरी के बाद होता है, तो फिर बेंजोडाइजेपिन लगा दी जाती है ऐसे पेशेंट्स को, तो वो ऑटोमेटिकली उनकी जो वॉमिटिंग है वो कंट्रोल हो जाती है ड्यू टू सेडेशन एज वेल एज ड्यू टू डिक्रीज एंजाइटी. नेक्स्ट क्लास इज कॉर्टिकोस्टेरॉइड. कॉर्टिकोस्टेरॉइड्स एक और स्लाइड है. आप इवनिंग वाले पढ़ने वाले बच्चे होके भी बस करते हैं, मॉर्निंग वालों को समझो इतना अच्छा नहीं पढ़ते जितना मॉर्निंग के स्टूडेंट्स अच्छे रिजल्ट लेकर आते हैं इस अब तक के जो हमारे एक्सपीरियंसेस हैं उसके मुताबिक. बट आपको पता नहीं क्यों बोलना शुरू कर देते हैं. मुझे अपना टारगेट अचीव करने दिया गया कि नेक्स्ट क्लास में फिर आपको ये वाला जो इसकी जो क्लास वाइज डिस्कशन है उसको खत्म कर देंगे और अल्टीमेटली आपका ये पूरा चैप्टर खत्म हो जाएगा. ठीक है. So corticosteroid including dexamethasone, as I said in the beginning that their mechanism is unknown, but it is thought that they act by blocking prostaglandin synthesis. And these are the medication used in combination. These are the medications which are used in combination. The last class is substance P or neurokinin 1 receptor antagonist. Neurokinin 1 receptor antagonist. And the commonly used drug in this class is aprepitant and zolpidem. They target specifically neurokinin receptors which are located in the vomiting center, as well as they block the effect of substance P, which is basically acting upon NK1 receptor. These medications are given orally along with combination of dexamethasone and 5-HT3 antagonists. Dexamethasone and 5-HT3 antagonists. Usually these are considered as effective for the control of delayed CINP. They specifically metabolized by cytochrome P3A4 system. So co-administration of this class with inducers or inhibitors. A strong inducer or inhibitor of what? Inducer and inhibitor of what? No. I said it is this class, NK1 receptor antagonist. It is specifically metabolized by cytochrome system, which is located where? In the कहाँ होगा? लिवर में. ठीक है, लिवर में होगा. अब होगा क्या कि कुछ ड्रग्स, पिछली क्लास में मैंने आपको बताया था कि कुछ ड्रग्स जो है वो साइटोक्रोम P450 एंजाइम सिस्टम को एक्टिवेट कर देती हैं या इंड्यूस कर देती हैं. और अगर हम ये वाली ड्रग ले रहे हैं जो कि NK1 रिसेप्टर एंटागनिस्ट है और उसके साथ हम कोई ऐसी मेडिसिन ले रहे हैं, फॉर एग्जाम्पल कोई भी न्यूरोजेनिक अमाइन है या कोई और ऐसा ड्रग है जो कि CNS पे एक्ट कर रहा है, बिकॉज मेजॉरिटी ऑफ एंटी डिप्रेसेंट्स जो है वो साइटोक्रोम सिस्टम से ही मेटाबोलाइज हो रही है। अगर तो वो मेडिकेशन इंड्यूस कर रही है इसकी एक्टिविटी को साइटोक्रोम की, तो वो मिनिमाइज कर देगी इफेक्टिवनेस ऑफ न्यूरोकाइनिन पी की एक्टिविटी को, उसका ड्यूरेशन कम कर देगी। क्यों? उसका मेटाबॉलिज्म फास्ट हो जाएगा। और दोज ड्रग विच आर inhibiting cytochrome system, which is responsible for the metabolism of neurokinin N1 receptor blocker, अगर उसको इनहिबिट कर रही है तो उसका मतलब है कि इसका एक्शन प्रोलॉन्ग हो जाएगा, इसका लेवल टॉक्सिसिटी के लेवल को भी क्रॉस कर सकता है। तो जब भी ये ड्रग ली जाए, स्ट्रॉन्ग इंड्यूसर्स और इनहिबिटर शुड ऑलवेज बी अवॉइडेड। अच्छा, वाइंडिंग अप हियर। In the next class, inshallah, we will discuss class-wise properties of different medication. And keep remember, we are just discussing those class of compounds which are useful for the treatment of emesis induced due to the anti-cancer drugs. ठीक है? और वो हम डिस्कस नहीं कर रहे इसलिए कि वो समझिए एक तरह से लोकल उनका इफेक्ट होता है और वो मल्टीपल यूज नहीं की जाती। मल्टीपल प्रोलॉन्ग जो इफेक्ट रिक्वायर्ड होता है इस एमिसिस को मिनिमाइज करने का, वो सिर्फ और सिर्फ पर है। तो मैं आपको फिर आगे चल के हो सकता है कुछ सवाल करूँ, आपको पता चले कि कौन सी ड्रग को क्यों उस पर्टिकुलर कंडीशन के लिए यूज़ किया जाता है जो कि एंटी एमेटिक है। जैसे मैंने आपको बताया था कि कुछ जो है वो स्ट्रॉन्ग एंटी एमेटिक प्रॉपर्टी रखती है मेडिकेशंस, और कुछ जो है वो लो एंटी एमेटिक प्रॉपर्टी रखते हैं। तो हम ज़रा गौर से देख लें कि सेंट्रल नर्वस सिस्टम में कौन कौन से एरियाज हैं, और इसके अलावा GI ट्रैक्ट में विच आर द रिसेप्टर्स एंड हाउ दे आर स्टिमुलेटेड। सो इन द प्रीवियस क्लास वी हैव डिस्कस्ड अबाउट द जर्नल कॉन्सेप्ट बिहाइंड एमिसिस and the mechanism of action of different anti-emetic classes and their mode of action as well as their general adverse effect in the previous class. Now look at the picture of brain which is highlighting the different receptors located at the different regions, and once these are stimulated they directly hit to stimulate two main areas which are controlling emesis, that is vomiting center, another one is chemoreceptor trigger. Is this clear? Also देखें that where the receptors are located and how once they are stimulated by the afferent input, and then vomiting will start by the impulse of efferent output which are arising from chemoreceptor trigger zone and vomiting center. ठीक है? So in the last class we had finished our discussion on combination of regimen which are used not only for the control of emesis but also some other disease. We are using different type of combination. The reason to use combination, what is the main reason to use combination? To minimize the adverse effects which are associated with any other highly effective and strong medication which can induce the adverse effect upon prolonged use. So by using the combination of medication we can increase the efficacy but decrease the potency, means the amount administered of that particular drug. Along with that we can minimize the associated adverse drug reaction due to one class of compound. For example, anti-emetic usually given in combinations, and there is a percentage response of different combination. If we check dexamethasone and ondansetron. Ondansetron belongs to which class? Which class? 5-HT receptor antagonist. And dexamethasone belongs to corticosteroids. Okay? And the previous class I told that ondansetron act by blocking competitively 5-HT3 receptor either present in the GI tract or in the central area of the nervous system, while dexamethasone belongs to corticosteroid class having no specific mode of action, or in other words we can say that there is no known mechanism of action of this class of medication, but it is thought that it acts by increasing the prostaglandin synthesis. So the different combinations having different percentage. The best response is seen when we are taking dexamethasone and ondansetron, while the second good combination of medication or regimen, we always use the term regimen because we are using a complex of different medication. And the second combination regimen is dexamethasone, diphenhydramide, metoclopramide and droperidol. These are belonging to different class of medication, and the other response or percent response which is seen due to this combination is about 76%. Okay? Now come to the next slide, which is basically in the previous class I told you that certain drugs are inducing extrapyramidal effect upon prolonged or chronic use of administration. So what are basically the extrapyramidal effects? These can be described by 5 different problems that will arise. One is torticollis, that is the inclination or bending of neck to one side, while the second one is oculogyric crisis, in which the person having an abnormal ocular movement, and lingual protrusion. This is the third type of extrapyramidal problem or adverse effect, which is seen in terms of hanging out of tongue of the patient, while blepharospasm, which can be explained by continuous twitching of eyelid. You might observe during your routine life sometime if you have sandy eyes or if you have any eye problem, for example eye infection, you feel that their eyelid is blinking continuously, which is uncontrolled, but sometimes it can be controlled by itself. But this phenomena is also observed when the person is having extrapyramidal adverse effect in terms of administration of certain class of medication. While akathisia is the turning of fore and the hind ear. So all these complex of problems can arise in extrapyramidal effect. Now come to one by one different classes which we have already discussed. We will discuss about the main effectiveness as well as the main adverse effect and their main mechanism of action or mode of action. For example, among all the classes of anti-emetic medications, serotonin 5-HT3, that is the specific receptor, and antagonists of these receptors are considered as potent anti-emetic agent. These are considered as potent anti-emetic agent. Now what is the reason? Because if you recall the picture of brain in which I have given you the distribution of different receptors at the different site. If you observe that the 5-HT3 receptors are also present in the GI tract, these are also present in your brain, these are also present in the vomiting center. So once we are giving this type of medication, it is acting to control emesis by antagonizing all different sites of receptors. Is that clear? That's why it is considered as an potent anti-emetic. And we have more concern emesis which is induced by chemotherapeutic agent. So that can also be controlled by continuous or chronic use of serotonin 5-HT3 receptor antagonist. Now in the next line it is written that centrally it blocks 5-HT3 receptor in the vomiting center, which I already described to you, as well as in the CTZ, and mainly peripheral 5-HT receptors on the extrinsic intestinal vagal and spinal afferent nerve. So क्या होगा इसमें टोटल ब्लॉकेज हो जाएगा तो ऑटोमेटिकली फिर एमएसएस रुक जाएगी. The antiemetic action of these agents is restricted to vagal stimulation. For example, in the post-operative condition, there is vomiting. So, its use or these agents can be used for the vagal stimulation as well as in chemotherapy. But motion sickness induced emesis is not controlled by 5-HT3 receptor antagonist. Now let me know what could be the reason behind. क्या रीजन हो सकता है आपके ख्याल में? मैंने आपको इसीलिए वो पिक्चर दिखाई थी कि आप उसको गौर से देखें और गौर से देखने के बाद you need to let me know that what is the reason, a precise reason. Yes? कहाँ पर नहीं होते? Yes, exactly. Very good. Why? Because if you check vestibular apparatus is comprising of H1 and M1 receptors, which are basically not controlled by. And what is motion sickness induced diarrhea as well as vomiting? It is basically the disbalance in your body movement. Means the brain are continuously getting signals at the time of movement or rotation or at the time of traveling, but it is uncoordinated. It is uncoordinated, but not all the people will suffer due to motion sickness. ठीक है? सारे लोगों को motion sickness नहीं होती. कुछ लोग होते हैं. For example, मुझे बहुत होती है जब मैं travel करती हूँ. It's mean my brain is unable to control and transmit signal to the vestibular apparatus at the appropriate time to make the balance of the body according to the traveling. So that is the reason of the induction of emesis in that motion sickness condition. So as the receptors for 5-HT3 are absent in vestibular apparatus, which is the main area which is balancing your body and which is balancing and maintain the balance of your body at the time of travel, so therefore we cannot use it in the motion sickness. Now come to the kinetics. If you check that there are 4 different agents which are listed in 5-HT3 antagonist, and the well known is ondansetron. 3 agents among the 4 having serum half-life of about 4 to 9 hours. This is the more prolonged action. And how? When it is administered orally or IV once a day. So the total half-life of 3 compounds which are listed in the first line continuously, that is ondansetron, granisetron and dolasetron. So these are having 4 to 9 half-life, while pulnanositron having half-life 40 hours when it is given IV. So it means this medication is reserved if the doctors are failed to control on if there is severe emesis is observed, because person to patient variable होता है ये condition. मैंने आपको पहले भी बताया था, बल्कि हमने जब फैक्टर्स देखे थे तो उसमें मेंशन किया था लास्ट में कि पेशेंट टू पेशेंट वेरिएबल होती है एमिटिंग टेंडेंसी. तो इस वजह से पोलांसिट्रोन जो है ये 40 इसका है, which means it is reserved for those patients who are unable to treat by the other agent in this class. Another important thing which is related with the kinetics of this class is that it does not bind with D2 and M type of receptor, so it does not affect on GIT mortality. That is the best thing for this, because if we are going to use muscarinic receptor blocker, H1 receptor blocker, they ultimately minimize the mortality of GI tract. That may lead to cause other adverse effect, and the most common adverse effect which is related with the GIT mortality is the constipation. Okay. Now if we discuss about clinical uses of this class, it is primarily used for CINV. The most effective when it is given as a single dose by IV 30 minutes prior to administration of chemotherapy. In the doses for ondansetron 8 mg, ranitidine 1 mg, dolasetron 100 mg, while pulanesetron is 0.25 mg. आप देखें कि pulanesetron जो है इसकी कितनी कम अमाउंट है. क्यों इसकी कम अमाउंट लेते हैं? बिकॉज इसका ऑलरेडी हाफ लाइफ बहुत ज़्यादा है. अगर ज़्यादा लेंगे तो डेफिनेटली ये थ्रेशोल्ड से ज़्यादा जाएगा और टॉक्सिक लेवल ज़्यादा अचीव करेंगे एज कम्पेयर टू बेनिफिशियल इफेक्ट. ओरल डोज गिवन 1 hour before chemotherapy of ondansetron, and I say that it is 8 mg twice per day or 24 mg once a day. Now it is used for the treatment of post-operative and post-radiation nausea and vomiting when other agents are restricted due to any adverse effect that cannot be incompatible with the patient. Okay? So its use is restricted for the post-operative vomiting as well as post-radiation or post-chemotherapeutic induced emesis too. But it is used to minimize the chance of emesis once it is given before the chemotherapy, which we have discussed in the clinical uses. Now come to adverse effects. The most common adverse effect is headache, dizziness and constipation. Headache और dizziness का reason ये होता है कि 5-HT3 receptors जो आपके brain में मौजूद होते हैं. तो 5-HT3 बेसिकली आपके मूड को एलिवेट भी करता है. सेरोटोनिन रिसेप्टर जो लाफ्टर न्यूरोट्रांसमीटर समझा जाता है, और इसकी वजह से बहुत पॉसिबल होता है कि आपको डिप्रेशन की तरफ चले जाए, हेडेक्स हों. स्पेसिफिकली अगर मिग्रेन का पेशेंट है तो मिग्रेन को कंट्रोल करने के लिए हम अमूमन जो है 5-HT एगोनिस्ट देते हैं. तो जब एंटागनिस्ट देंगे तो डेफिनेटली वो हेडेक के चांसेस बढ़ा देगा, डिजीनेस भी हो सकती है एंड कॉन्स्टिपेशन भी हो सकती है. While the significant problem that arises by the use of this is QT interval prolongation. So those having cardiac problem related with the QT interval prolongation, in that patient this type and this class of medication should be avoided. So again, QT prolongation has been shown in the picture. If you check that there is a distance between QRST interval, a possible number of digits which will cross in the QT interval are minimum. But once you are using this type of medication, it ultimately increases the QT interval because it is also hitting certain brain area as well as in the cardiac muscle. There are certain receptors which are initiated, so that will be the result of it. So it is better that those patients having cardiac illness which is related with QT interval prolongation, these patients should avoid to take this type of medication. As far as their drug interactions are concerned, there is no significant interaction. All 4 agents undergoes some metabolism by hepatic cytochrome P450. But the good thing is good thing is that they do not appear to affect the metabolism of other drugs. Usually, if one drug is passing through cytochrome P450 system, if another drug is also passing through the metabolic pathway by same route, so there may be the saturation of enzyme that can inhibit, but it is seen in that case, maybe the isoenzyme in the cytochrome P450 system, which is used by 5-HT receptor blocker, is a different kind as compared to other. But keep remember those medications which are either inducing the activity of cytochrome P450 system or antagonizing or decreasing the activity of cytochrome P450 enzyme system, they can interfere in the metabolism. अगर इनहिबिट कर रहा होगा कोई सिस्टम साइटोक्रोम P450 को, तो जो उसका अमाउंट है वो ब्लड के अंदर ज़्यादा हो जाएगा ड्रग का, ठीक है। तो हाफ लाइफ उतना ही ज़्यादा स्टे करेगी, उसकी बायो अवेलेबिलिटी उतनी ज़्यादा होगी। और अगर सेकेंड डोज एडमिनिस्टर कर दी एंड द पीपल हैविंग नो आइडिया अबाउट द एडमिनिस्ट्रेशन ऑफ अदर ड्रग विच इज अफेक्टिंग द साइटोक्रोम P450 सिस्टम, so ultimately the effect of 5-HT3 antagonist will be increased. And if we are giving inhibitory, acceleratory medication which are accelerating cytochrome P450 system, so the amount of this drug will be minimized because of the rapid metabolism by the induction of other drug of the system which is related with cytochrome P450. Is it clear? Any problem up till now? No. Okay. Now come to corticosteroid. This is the second class of medication which we have already discussed in the previous class, that it is having no any known effect, but it is thought that it acts by increasing the synthesis of prostaglandin. Two compounds are included which are commonly used for chemotherapeutic induced emesis, that is dexamethasone and methylprednisolone. अच्छा, अब कोई आई प्रिपरेशन आपने देखा हो, जैसे नेब्रा है, ये टोब्रामाइसिन है, आई के लिए आती है। अब उसमें नेब्रा का चूंकि इफेक्ट अगर नहीं आ रहा या उसको मल्टीपल टाइम एडमिनिस्टर करना पड़ रहा है, तो पेशेंट की कंप्लाइंस को देखते हुए और मिनिमाइज करने के लिए नंबर ऑफ डोजेस को नेब्रा के साथ डेक्सामेथासोन को एडमिनिस्टर किया जाता है। और इसका एक प्रिपरेशन आता है डेक्स नेब्रा के नाम से। तो उसमें क्या होता है, ये डेक्सामेथासोन होता है। उससे क्या होता है कि आप मिनिमम डोजेस में आप मैक्सिमम इफेक्ट अचीव कर सकते हैं। तो सेम इज हियर, सो वी आर यूजिंग इन द रेजिमेंट ondansetron along with the dexamethasone. So it appeared to enhance efficacy of, it is also thought that it appeared to enhance the efficacy of 5-HT3 receptor antagonist. So that may be the mechanism for the purpose we are using it in combination with ondansetron. Usually the dose is 8 to 20 milligram IV before chemotherapy, and it is followed by 8 milligram per day orally for 2 to 4 days. The major adverse effect which is seen that it enhances appetite. This corticosteroid class of compound, they enhance appetite. So that is the reason that people will feel increase in their weight, which is associated with the concomitant use of or continuous use of corticosteroid type of medication. Okay. Now come to neurokinin receptor antagonists or NK1 receptor antagonists, which are comprising of 3 different type of agent: aprepitant, nutipitant and rulapitant. All are orally active and they act on the receptor which is located in the brain, and that is NK1 receptor. And how it produces its effect? By crossing blood-brain barrier. It has no affinity with other receptor, for example, D receptor, 5-HT3 receptor and steroid type of receptor. Nutipitant, which is given in 300 milligram, is available only as a combination combination product with relansitron, which is present in amount 0.5 milligram. ठीक है, कॉम्बिनेशन में इसलिए दिया जाता है ताकि हम मैक्सिमम इफेक्ट अचीव करें, और यूजुअली रेजिमेंट्स आर गिवन इन मैक्सिमम इन कॉम्बिनेशन टू दोज पेशेंट हु कैन नॉट टॉलरेट विद द एमएसएस इंड्यूस्ड बाय यूज ऑफ रेडिएशन और कीमोथेराप्यूटिक इंड्यूस्ड एमएसएस. It has longer half-life, that is about 90 to 180 hours. You can understand that it is having a very long half-life, so it should be given in a single dose. So this is also increasing compatibility or compliance of patient. क्योंकि ऑलरेडी कीमोथेरेपी में मल्टीपल टाइप ड्रग एडमिनिस्ट्रेड कीमोथेरेपी की भी की जा रही होती हैं, और उसके साथ और भी दूसरी मेडिकेशंस जो कि सिम्टोमेटिक ट्रीटमेंट के तौर पर दी जा रही होती है. फॉर एग्जांपल अगर पेन है तो पेन किलर भी दिया जा रहा होगा, अगर कोई और इशू है, रैश पड़ जाते हैं बाद लोगों को स्किन पे, तो फिर उनको एंटी एलर्जी भी दी जा रही होती है. तो उस सूरत में एमएसएस को टॉलरेट करना इज डिफिकल्ट, स्पेशली एट द टाइम ऑफ एडमिनिस्ट्रेशन ऑफ कीमोथेरेपी. तो ऐसी ड्रग दी जाती है जो प्रोलॉन्ग आपको इफेक्टिवनेस दे, और बार चूँकि हॉस्पिटल में लेके जाना पेशेंट को और वहाँ बार आईवी के थ्रू एडमिनिस्टर कराना इज डिफिकल्ट. तो वंस अगर ये दे दी जाए तो आपको इतना प्रोलॉन्ग इसका इफेक्ट मिल सकता है. नाउ NK1 ब्लॉकर आर गिवन इन कॉम्बिनेशन विद 5-HT corticosteroid to control acute emesis in 90% of patients. That is the good thing. While it is metabolized by cytochrome P3A4 and may inhibit the metabolism of other drugs. अच्छा, cytochrome P450 सिस्टम जो है ना, इसमें ह्यूज आइसोएंजाइम है, वो एक एंजाइम नहीं है, मल्टीपल एंजाइम है और मल्टीपल इफेक्ट कर रहे होते हैं. अच्छा, जो 5-HT था वो 5-HT जो है वो साइटोक्रोम P450 से डायरेक्टली कर रहा है, और उसके अंदर आइसोएंजाइम और भी है. अगर कोई ड्रग स्पेसिफिक आइसोएंजाइम के थ्रू मेटाबोलाइज हो रही है तो वो ड्रग इंटरेक्शन में इन्वॉल्व हो सकती है. इसी वजह से 5-HT रिसेप्टर 3 जो था वो किसी भी ड्रग को ना तो इनहिबिट करता है और ना ही उसकी कंसंट्रेशन पर इफेक्ट करता है. एंटीसाइकोटिक एजेंट में आपके पास हैं टोटल फिनोथाइजीन एंड ब्यूटाराफिनॉल. फिनोथाइजीन mediated through inhibition of D receptor and muscarinic receptor, progliprazine and promethazine and thiopyrazine. The anti-emetic properties of olanzapine is by blocking D2 receptor, 5-HT1C receptor and 5-HT3 receptor. So all these medications which are classified as an antipsychotic, among these phenothiazine is acting by dopamine and M1 receptor, while the remaining 3 as well as olanzapine, they are acting by blocking D2 receptor, 5-HT1/3 receptor as well as 5-HT3 receptor. Butyrophenones act by blocking D receptor in the brain, while droperidol, it is also listed in this class, is given by IV and IM in post-operative nausea and vomiting because it is having sedative effect. Previously used for the maintenance of general anesthesia. When you will go in the next class in 609, when we will talk about and we will teach you about the general anesthetic as well as local anesthetic. In general anesthetic, there are different cycles of induction of anesthesia prior operation. ठीक है, उसमें जो different cycles हैं, उसके लिहाज से combination दिया जाता है. एक वो जो कि सेडेट करे ब्रेन को, और ये सारे एक कॉम्बिनेशन जो रेजिमेन है वो प्रोलॉन्ग करते हैं ऑपरेशन के टाइम में आपकी सेडेशन को या एनेस्थेटिक कंडीशन को. तो उसमें से एक ड्रोपेरिडोल भी है जो कि नॉजिया वॉमिटिंग को भी कंट्रोल करता है. मीन्स अगर हम ऑपरेशन के टाइम पर या
सर्जरी के टाइम पर एनेस्थेटिक के साथ दे रहे हैं तो ये पोस्ट ऑपरेटिव वॉमिटिंग को भी कंट्रोल करेगा बाय सेडेटिंग द ब्रेन एज वेल एज इट इंक्रीज द एक्टिविटी ऑफ सेडेटिव एज वेल एज एनेस्थेटिक एजेंट. Adverse reactions for antipsychotics are the same, that it prolong QT interval. The fourth class of medication are substituted benzamide, and in this class two agents are included, metoclopramide and trimethobenzamide. Metoclopramide and trimethobenzamide, most commonly used is metoclopramide. Its mechanism is to block dopamine receptor. Metoclopramide should be given 10 to 20 milligram orally or IV after every 6 hours. अच्छा, अब आप अगर गौर से देखें, मैंने आपको 5-HT रिसेप्टर पहले बताए. 5-HT रिसेप्टर एंटागोनिस्ट पहले बताने का मकसद ये है कि अगर आप गौर से देखें तो जो एडमिनिस्ट्रेशन टाइम है मेडिकेशन का, वो मिनिमम आपको किस में नजर आ रहा है, किस कंडीशन, कौन सी क्लास में मिनिमम एडमिनिस्ट्रेशन टाइम, ये सब मिनिमम डोजेज हैं, मिनिमम डोजेज 5-HT3 में मिनिमम डोजेज हैं. या तो आप वंस अ डे देते हैं या ट्वाइस अ डे देते हैं. अगर हम सब्स्टिट्यूटेड बेंजामाइड लेते हैं तो यू कैन चेक दैट अगर हम ये दे रहे हैं, आईवी भी दे रहे हैं, ओरली भी दे रहे हैं, तो हमें इसका सेकेंड डोज रिपीट करना पड़ेगा आफ्टर 6 आवर इफ इट इज़ अनएबल टू कंट्रोल. सही. तो इसी वजह से जो सुपीरियरिटी दी गई है कीमोथेरापेटिक इंड्यूस वॉमिटिंग को कंट्रोल करने के लिए, दैट इज गिवन टू 5-HT3 receptor, or we can say that these are the first line of treatment too. ठीक है, उसको प्रायोरिटी दी गई है because of the efficacy as well as the compliance of patient is also good in that case. Adverse drug reactions are extrapyramidal effect, restlessness and dystonia and Parkinsonism. In the next class में होंगी अब आपको, हाँ. तो अभी तो आप लोगों ने मुझे कल बताया था कि नेक्स्ट क्लास में. ओके, बस ये देख लें. पार्किंसोनिज्म है, तो ये जो मैंने दो दिखाई है पिक्चर्स, इसमें पार्किंसोनिज्म, वाइल जो डिस्टोनिया है इसमें क्या होता है, लिप्स आपकी गर्दन, आपके जो हाथ में, फोर एंड हैंड लिप, इनमें सिमिलर टाइप ऑफ एक्स्ट्रा पैरामिडल इफेक्ट आते हैं. अच्छा, एंटी हिस्टामिन आप 2 मिनट का, इसके बाद ये खत्म हो जाएगा टॉपिक. सो 5th क्लास ऑफ कंपाउंड इज H1 एंटी हिस्टामिन एंड एंटी कोलिनर्जिक ड्रग. कीप साइलेंस. If you are not interested, you can leave the class. These drugs can be given as a single agent, and these are considered as weak antiemetic, which I have already shown in the previous class, in which I classify different medication and different classes according to their efficacy, according to their potency, that superior, medium and the low tendency to control emesis. So these two agents are particularly listed as a weak antiemetic and commonly given to control motion sickness. The compound including diphenhydramide, dimenhydrinate, and these belongs to first generation H1 antagonists. Their use may be limited due to its adverse effect including dizziness, sedation, urinary retention and cycloplegia. What is cycloplegia? Cycloplegia is related with the eye problem, and the person is unable to accommodate the vision, far vision or near vision. That is termed as cycloplegia. Maclazine is another compound which is listed as H1 antagonist, while leucine and scopolamine are prototype muscarinic receptor antagonist, is one of the best agents for the prevention of motion sickness, but it is usually क्योंकि M1 receptor को ये antagonize कर रहा है तो definitely आपका GIT system भी इसकी वजह से खराब होगा. So best is that they should be given in transdermal patches, जिसमें आपकी neck पर patches लगा दिए जाते हैं and they can facilitate to minimize the problem which is related to MSS. Benzodiazepines, ये सारे कौन से वाले compounds हैं? Benzodiazepine is the next class which is including diazepam and lorazepam, and these are useful for initiation of chemotherapy to reduce anticipatory vomiting and vomiting caused by anxiety. Central nervous system पे ये directly act करेगी. I shown a complete area which is affected or which is continuously transmitting afferent nerves or afferent transmission to the vomiting center as well as CTZ, and such type of MSS is associated with the depression and anxiety. So usually sometime patient feel anxiety once he or she will get aware about that he is undergoing into chemotherapeutic treatment. So to minimize that anxiety, it is preferable to give anticipatory. Means मुतवक्को MSS को ज़रूरी नहीं है कि MSS हो. So last agent in the class of antiemetic is the cannabinoid. Cannabinoids are basically psychotic chemicals, and they are comprising of pronabinol. These are marijuana type of compound, and medically these are used to enhance and stimulate appetite, as well as these are having anti-emetic activity, but the exact mechanism is unknown. These are commonly not available. Legal medications, these are not available freely. Their combination therapy with phenothiazine provide a synergistic anti-emetic action and appears to attenuate the adverse effect of both agents. Okay, synergistic means just like if we are using 5-HT3 receptor blocker along with the dexamethasone, we can minimize the adverse effect of 5-HT as well as corticosteroid. So similar type of effect is seen when we are going to use cannabinoid as an anti-emetic in combination regimen. It can minimize the adverse effect associated with both agent as well as it is inducing synergistic activity. Nebilon is another agent. Now it is approved by USA FDA for the treatment of what? MSS. So the quote of the day for you people today is, it is difficult to be patient, but to waste the reward of patient is worse. Is this clear? अगर आप पेशेंस नहीं रखते तो जो उसके बदले में आपको रिवॉर्ड मिलने लगा था वो ख़त्म हो जाएगा. तो हमेशा हर चीज़ में, किसी भी मसले में पेशेंस का मुजाहरा करें, चाहे वो क्लास ले रहे हैं, चाहे वो आप पेशेंट को ट्रीट कर रहे हैं, चाहे किसी पर्सन को ट्रीट कर रहे हैं. तो ये इट इज़ नेसेसरी दैट यू नीड टू बी पेशेंट थ्रू आउट योर लाइफ. It will reward you in the positive way. Thank you so much, class.